Prostate cancer is a diagnosis that strikes fear into the hearts of men worldwide. It is a disease that affects not only physical health, but also mental and emotional well-being. One of the most significant concerns for men facing prostate cancer treatment is the potential side effect of erectile dysfunction. The fear of losing intimacy and sexual function can be devastating. For years, men undergoing prostate cancer surgery have faced a difficult choice: accept a higher risk of erectile dysfunction to potentially cure their cancer, or opt for less invasive treatments that may not be as effective. However, a groundbreaking new surgical technique called NeuroSAFE is offering renewed hope to thousands of men. This revolutionary approach is transforming the landscape of prostate cancer treatment by significantly reducing the risk of erectile dysfunction while still effectively targeting and removing cancerous tissue. NeuroSAFE represents a paradigm shift in prostate cancer care, providing men with the opportunity to overcome their illness without sacrificing their quality of life. This essay will delve into the details of NeuroSAFE, exploring its impact, the science behind its success, and the inspiring stories of patients whose lives have been transformed by this groundbreaking procedure. Erectile dysfunction, often referred to as ED, is a common and often unspoken consequence of prostate cancer treatment. Traditional surgical methods, while effective in removing the prostate gland, can damage delicate nerves and blood vessels surrounding the prostate that are essential for achieving and maintaining an erection. This damage occurs because these vital nerves and blood vessels run very close to the prostate gland. During surgery, it can be difficult to differentiate between cancerous tissue and these essential structures. As a result, men who undergo traditional prostate cancer surgery often experience some degree of erectile dysfunction, ranging from mild to severe. The impact of ED on men's lives extends far beyond the bedroom. It can lead to feelings of inadequacy, shame, and depression. Relationships can suffer, and many men withdraw from their partners, both emotionally and physically. The emotional toll of ED can be as debilitating as the physical effects, highlighting the urgent need for a solution that addresses both the cancer and the potential side effects of treatment. NeuroSAFE, which stands for Neuroanatomical Safe Dissection for Erectile Function Preservation, is a nerve-sparing surgical technique that represents a major advancement in prostate cancer treatment. Developed by leading surgeons and researchers, NeuroSAFE focuses on preserving the delicate nerves and blood vessels responsible for erectile function, while still ensuring the complete removal of cancerous tissue. Unlike traditional methods that rely on visual identification of these critical structures, NeuroSAFE utilizes advanced technology to precisely map and protect the nerves during surgery. This meticulous approach minimizes the risk of nerve damage, significantly reducing the likelihood of post-operative erectile dysfunction. The development of NeuroSAFE was driven by a deep understanding of the anatomical relationship between the prostate gland, surrounding nerves, and blood vessels. By meticulously mapping these structures, surgeons can operate with a level of precision that was previously unattainable. This breakthrough technique offers men new hope for a healthy and fulfilling life after prostate cancer, allowing them to maintain their sexual function and overall quality of life. The remarkable effectiveness of NeuroSAFE has been scientifically validated in a landmark study published in The Lancet, one of the world's most prestigious medical journals. This study, conducted across multiple leading hospitals, compared the outcomes of men who underwent NeuroSAFE surgery with those who received traditional prostate cancer surgery. The results were nothing short of astounding. The study found that men who underwent the NeuroSAFE procedure were significantly more likely to retain their erectile function after surgery compared to those who had traditional surgery. In fact, the study reported that NeuroSAFE patients experienced a remarkable 75% reduction in the risk of severe erectile dysfunction. These findings have sent ripples of excitement through the medical community as they demonstrate the potential of NeuroSAFE to revolutionize prostate cancer treatment. The Lancet study provides compelling evidence that NeuroSAFE is not only safe and effective, but also has the potential to improve the lives of countless men diagnosed with prostate cancer. Section 5. Courtney Ming, a life changed by NeuroSAFE. One of the most powerful testaments to the life-changing impact of NeuroSAFE is the story of Courtney Ming, a 58-year-old man from London who was diagnosed with prostate cancer in 2023. Facing the daunting prospect of surgery and the potential side effects, Courtney was determined to find the best possible treatment option. After extensive research and consultations with leading urologists, Courtney decided to undergo the NeuroSAFE procedure. He was drawn to the technique's focus on nerve preservation and its impressive success rates in clinical trials. "I was scared, of course," Courtney recalls, "but I was also determined to maintain my quality of life after surgery." Courtney's surgery was a resounding success. He recovered quickly, and most importantly, retained his erectile function. "I feel incredibly fortunate to have had access to this groundbreaking procedure," Courtney shares. "NeuroSAFE has given me my life back." Courtney's story is just one of many that highlight the transformative power of NeuroSAFE. His experience underscores the importance of this innovative technique in providing men with hope and a brighter future after prostate cancer. Section 6. Understanding the precision of NeuroSAFE. The key to NeuroSAFE's success lies in its meticulous approach to nerve preservation. During the procedure, surgeons use a high-definition laparoscopic camera to obtain a magnified and illuminated view of the surgical field. This enhanced visualization allows for precise identification and dissection of the delicate nerves and blood vessels surrounding the prostate gland. In addition to advanced imaging, NeuroSAFE also employs specialized surgical instruments designed to minimize trauma to surrounding tissues. These instruments, combined with the surgeon's expertise in nerve-sparing techniques, enable the removal of the prostate gland with minimal disruption to the intricate network of nerves responsible for erectile function. The NeuroSAFE procedure typically involves a shorter hospital stay and faster recovery time compared to traditional prostate surgery. This is because the minimally invasive nature of the surgery results in less pain, scarring, and overall trauma to the body. The combination of cutting-edge technology, specialized instruments, and expert surgical skill makes NeuroSAFE a game-changer in the field of prostate cancer treatment. Section 7. A call for wider adoption across the NHS. Despite its remarkable success and life-changing potential, NeuroSAFE is not yet widely available across all NHS hospitals. This limited access means that many men facing prostate cancer are not being offered the best possible treatment option. Leading urologists and patient advocacy groups are calling for the rapid implementation of NeuroSAFE across the NHS. They argue that this groundbreaking technique should be the standard of care for all men undergoing prostate cancer surgery, ensuring that every patient has the opportunity to benefit from its nerve-sparing advantages. Increased funding and resources are needed to train surgeons in the NeuroSAFE technique and equip hospitals with the necessary technology. The widespread adoption of NeuroSAFE would represent a significant investment in men's health and well-being, improving outcomes and enhancing the quality of life for countless individuals. The time to act is now. Making NeuroSAFE accessible to all men diagnosed with prostate cancer is not just a medical imperative, but also a moral obligation. Section 8. The future of prostate cancer care, screening, and early intervention. The development and implementation of NeuroSAFE mark a significant step forward in prostate cancer care. However, to fully realize the potential of this groundbreaking technique, it's crucial to focus on early detection through national screening programs. Prostate cancer often develops without noticeable symptoms in its early stages, making regular screening essential for identifying the disease when it's most treatable. A national screening program would provide men with greater awareness of their risk factors and encourage them to undergo regular checkups, leading to earlier diagnoses and more successful treatment outcomes. Early detection through screening is particularly important for NeuroSAFE, as the procedure is most effective when performed on men with localized prostate cancer. When diagnosed and treated early, the chances of preserving erectile function through NeuroSAFE are significantly higher. By combining the precision of NeuroSAFE with the power of early detection through national screening, we can move towards a future where prostate cancer is no longer a disease that robs men of their health, intimacy, and quality of life. NeuroSAFE, ushering in a new era of hope and confidence. NeuroSAFE offers men renewed hope and a brighter future in prostate cancer treatment. This technique reduces the risk of erectile dysfunction, transforming lives with confidence and optimism. Clinical trials and patient stories highlight NeuroSAFE's transformative impact. It's about preserving quality of life and intimacy. Widespread adoption of NeuroSAFE is a moral imperative. Ensuring all men benefit from this procedure is crucial. Expand access, increase awareness, and advance